anterior intercostal arteries along the inferior and superior borders of the rib. Then subdivide into vessels muscular phrenica and phrenica superior due to supply the pericardium and some of mediastinal lymph nodes and fat tissue. So, then on this preparation, где он меня? Stand by me. So slim, small girl. So remove heart to this portion. So first of all, we recognize the aorta, right auricle. So remove like this, left auricle. Then interventral groove, interventricular groove with the anterior interventricular artery. So in this place we name coronary groove, and this portion, remove like this portion of aorta we name the ascending part of aorta. This is pulmonary trunk. Pulmonary trunk is located forward. Aorta, ascending part of aorta. Then we demonstrate in this place from this to this arch of aorta. After that, descending part of aorta. So in this place, we recognize, take this. We recognize the superior vena cava, which is formed by joining of left and right brachiocephalic vein. We recognize place of location of internal jugular vein and right subclavian vein. Then you recognize the vessels which drain into the angle, and где у нас тут? Thoracic duct, which in this classic variation into the angle. So in this case, the vessels which is named superficial cervical vein, in this direction suprascapular vein, parallel to it we can remove to recognize the arteries, the same superficial, then vertebral artery, vertebral vein. So in this case we find the location, we remove the location of retromandibular vein, then posterior group of vessels, and we name this as the external jugular vein, So some vessels forms as outflow from the thyroid gland, unpaired or thyroidea, it drains into this or this brachiocephalic vein. So the same outflow from superficial on the superficial vessel, this place of location of venous arch, which we name as the anterior jugular vein, anterior external and internal jugular vein. In this case, venous outflow drains into this place unpaired. In this case, I remove you the same, recognize location of the external, location of vertebral, and place of location of subclavian and axillary till the level of external aspect of the first three, place of exchanging the name from axillary to the subclavian. So in this place, remove like this. In this place, you can recognize the place of venous outflow via the vessel, which is named. How do we name? On right and left side. How do we name? No. Which vessel in this place? Which vessel? Which large vessels? Which large veins are located in this place? We name on the right side azygos vein, on the left side hemiazygos vein. To check your knowledge, first of all, we have to find the location of intercostal veins. Intercostal veins form azygous vein on the right side, hemiazygous on the left side. In case of the left side, the same. You check to recognize hemiazygous. Upper portion drains into accessory hemiazygous vein. Lower part hemiazygous, upper part accessory, on the right aspect azygous. In preparation from study department, you can recognize two cases. In one case, one vessel instead of two vessels on the right and left side. For location of these vessels, first of all, you find intercostal veins. On the right side, lower portion, on the left side, most of portion, and upper left side for accessorium hemiazygous vein. Do you understand? Go down. Firstly, on this preparation, you recognize the location of left gastric artery. In this case, you recognize the location of so on this preparation, remove this, please. All intestine to this side. So on this preparation, you recognize the location, place of forming of hepatic portal vein. You recognize superior mesenteric vein. You recognize splenic vein. You recognize splenic artery to check place of location of the celiac trunk, place of location of left gastric arteries and place of location of common hepatic artery, beginning of celiac trunk. We now find the same venous vessel. We recognize the vena porta hepatis. One of sources is splenic vein. Other sources is superior mesenteric vein. And then we remove to this side, to right side. So careful, to right side. We find the large intestine. We recognize the beginning of inferior mesenteric vein. Remove, so careful there. And we find the, not beginning, in my opinion it was like this. It can drains into the splenic vein, it can drains into the proper, into hepatic portal veins, or it can drains into the superior mesenteric, into superior, into splenic, into the proper hepatic veins, into portal hepatic veins. Do you understand? Yes. In case of location of inferior vena cava, first of all you find the aorta to the right side, inferior vena cava. In case of inferior vena cava, place of forming, help me remove the intestine. In case of inferior vena cava, the same as aorta, we find common iliac vein, right and left common iliac vein together form vena cava inferior. It goes up. Then you know about the renal vein. Then vein which come from suprarenal gland, suprarenal or adrenal vein. Not as in case of artery. In case of artery, 3 vessels supply the suprarenal gland. In case of veins, only 1 vein, suprarenal or adrenal vein. It can drain into the inferior or into the renal vein. So, and lastly, the location of, remove large intestine to the right side. And we find the location of testicular vein, which the same drain into the renal vein. But on the right side, it drains. Check, remove. So careful. On this side, you can remove and recognize testicular vein drains on the right side into the vena cava inferior. We name the same vessels. Sources for inferior vena cava are the same as the branches of abdominal aorta. So, but unpaired vessels, veins with the same name, form vena. Где она у нас тут? Remove to this place. I repeat. Form vena porta hepatis. Vena porta hepatis organized backward the head of pancreas. Somebody removed our pancreas and you saw vena porta hepatis in preparation, but preparation not just now in our room. So, in case of the greater curvature, we have to recognize large vessels which drains the same into vena porta hepatis along the greater curvature, left into the splenic, right into the porta hepatis just after the going away from the stomach. Do you understand? Yes. So, in case of the in case of the porta hepatis, you have to recognize the location of the structures. In all controls, I ask you the location of structures. Then backward porta hepatis and most left position, location of the artery. Somebody demonstrated me branches of arteria hepatic propria, you today in the morning, hepatic propria instead of right hepatic duct. We have to recognize duct only when you find common hepatic duct to this side or to this side. To this side left, to this side right. You demonstrate instead of bile system, you demonstrate me proper hepatic artery, the left branch of proper hepatic artery. Так, so, do you understand?
Yes.
Так, все, we close.